Hey everyone, welcome back to the Medical Care Organizations course. This is lesson number 4. Okay, so for lesson number 4, we're going to go over medical service professionals. So what we're going to do here is we're just going to go through and take a look at some of the major health service professionals that are working in the healthcare industry today. Okay, so this may be actually a really quick lesson as compared to the first 3 so far. Let's just dive right in. First of all, health service professionals. Actually, the healthcare industry itself is the largest and most powerful employer in America. Okay. It comprises of more than 13% of the total labor force. I know it says 13% here, although now it has grown. Okay, so this statistic was put there a couple of years ago, and I know for sure now at this moment we are growing, we are expanding, and we're going to get into a reason for why healthcare is expanding so much. Okay, so in 2011 itself, the gross domestic product that we were that was at 17.9%. That's quite a bit. Just the healthcare industry itself. Okay, so just to give you kind of like, just to put in perspective of how huge and how powerful, and also how high our healthcare expenditures are going in healthcare delivery. Okay, so and healthcare is going to continue to grow. It's going to keep expanding. All right, so one major reason for that, actually there are 2 huge reasons, but first of all we're going to look at the first one, and that is the fact that our population keeps growing. Our population keeps expanding, all right, and it doesn't look like we're slowing down. I know that right now we have over 7 billion people, right? Aren't we approaching 8 billion? 10 years ago when I was in college, we were at 6 billion. So we are definitely expanding. That population is growing tremendously, and it's not showing any signs of really slowing down. Okay, so, and of course, people will always need healthcare. So as long as there are people, we will need healthcare. And as long as our population is growing, we're going to see growth in healthcare. Okay. Secondly, we have an aging population in the United States, actually all over the world. But this is because of our baby boomers are now aging. Okay, they're getting older, they're going into retirement, many are going into long-term care services and whatnot. And this is so significant because this generation was really the first generation that was so huge. Okay, society or civilization never really experienced such a huge population just being born into the world at one time, like in one generation, in one range of years. Okay, so and that generation has been like a driving force in our society, economically, politically, and in so many ways throughout the years. But now they're finally aging. Okay, so they're coming towards the end. They're leaving the workforce. Okay, so we're not going to have all that money coming in through taxes and whatnot. And they're also going to be more dependent on the healthcare system as they start to age, retire, and So, and they're going to start to need more long-term care services. So for that reason alone, we're going to start to see more and more of a growing need of healthcare workers, healthcare professionals, new healthcare technicians for the new technology that we're going to develop in the future, and just new, more and more healthcare professionals working in this field, especially, those areas in medicine that have to do with long-term care and the services that the baby booming population that they're going to utilize in the future. Okay, so just because of that, we're definitely going to see healthcare grow. All right, let's move on. Throughout this this lecture, we're gonna look at the different types of services and how they are distributed, how they the different types of providers have evolved over time. We're gonna look at also what I want you guys to really focus on when we look at the different types of professionals is keep in mind the education level that they had to have. Pay attention to which professionals have to be licensed by the state, which professionals need to be certified, which professionals don't really need anything to practice. Okay, and also we're gonna dive into some of the imbalances that we do have in healthcare and health services. Okay, so let's move on with that. This is kind of a list, and just to give you an idea of all the different types of health service professionals that we have out there, because many people probably, when we think of health service professionals, I'm sure we all think, physician, okay, that's like not that important. I keep forgetting how to use this pen, I'm so sorry. But most people think of, on the previous slide, most people think of physicians and nurses. However, there are many other different types of health service professionals. So that on the previous slide is just going to kind of give you a list of the different professionals that are out there. Okay. And this slide right here gives you a list of different workplaces in which health service professionals work. Okay, so where they provide their services. Let's move on. Okay, so of all the different places where they work, hospitals are the most common. 40.5% of all the healthcare professionals out there are employed by hospitals. Okay. Following that, at 12.1%, we have nursing and personal care facilities. So like skilled nursing facilities and a lot of long-term care type organizations, personal care facilities, that's what that is. So like assisted living and other places in long-term care. So that seems to be the second highest, and it's still not even remotely close to being 40.5%. Okay, so the hospital itself is really the institutional core of health services delivery in the United States. Okay, they employ majority of the health service professionals. Okay, and then third highest would be at 10%. We have physicians' offices and clinics. So this is the outpatient services section. Okay, of course there are many other different areas where health service professionals do work. There are pharmacies, research and development, schools even, and a variety of many other places where they do work. Okay, so moving on. We're actually going to move forward from that. All right, so let's jump into physicians. All right, so physicians play a very essential role in taking care of a patient, right? Our healthcare delivery system is kind of built in such a way where the patient to physician interaction is pretty much like the center of how healthcare works. Okay, it starts with that and then it kind of expands outward, right? So anyway, to become a physician, you are required to be licensed by the state. And in order to be licensed by the state where you're practicing, you need to graduate from an accredited medical school, you need to pass your licensure exam, and you have to have completed 2 or more years of like a residency internship type, basically this is where you're going to get your physical hands-on experience prior to actually being like a full, licensed physician. Okay, so you need 2 to 6 years. Usually, in some cases, they call this an internship. In other cases, this is when you do a residency. Okay, so anyway, moving on, there are 2 different types of degrees you can get as a physician. Okay, so the first is the MD degree. Let me change the color. So the MD degree, that is the Doctor of Medicine degree. So this degree focuses on modern medicine or allopathic medicine. Okay, so allopathic medicine, really, we're not going to get too much into like the philosophy side of allopathic medicine. However, just keep in mind that they do tend to focus on the physical symptoms of the patient. Okay, so that's sort of like how their whole thing is centered around. The physical symptoms of the patient, let's relieve the physical symptoms, and then the patient's good. Okay, that's the big idea there. Now, most MDs do become specialists. Okay, now moving on to the next degree that you can get as a physician, the next degree you can get is a DO. So that is a Doctor of Osteopathic Medicine. Okay. Now these physicians, their philosophy that they learn in medical school is going to be a little bit different from the MD. Okay. These physicians are taught to see the body as a whole. Okay, so basically they practice holistic medicine. Okay, so what they learn in medical schools, they do everything allopathic. Okay, so everything that the MD students do, they do as well. However, the difference is the DOs, or the Doctor of Osteopathic Medicine, these guys, they learn alternative medicine as well. So they learn acupuncture, they learn other holistic therapies in addition to allopathic medicine. Okay, so it kind of gives them a broader scope of what's going on with the body, and it changes the mindset and the way that they view the patient. Okay, so when a patient is sick, they like to look at the body as a whole. They want as a whole. So in their ways and their mindset, they focus, I guess you would just say, they do more holistic medicine. Okay, they do not tend to just look at symptoms only. They want to kind of dive in and see why the body is not naturally healing itself. Let's try to fix the causes of this. Okay, so anyways, most of the DOs that most of the people who get the DO degree become generalists. Okay, which is probably obvious given the philosophy that we just discussed about how, what they're learning in medical school. Okay, because they like to see the body as a whole, they like to look at everything. So they do actually kind of fit the idea of a generalist, right? And just as well as the MDs kind of fit a specialist type of mentality in a way, because they do care more about just sort of zooming in on those symptoms only, right? Let's look at the symptoms and let's relieve the symptoms and all that. So they are definitely going to be more focused on specializing in certain areas and then developing more medical technology and things like that. So let's move forward. So DOs, the osteopathic medicine physicians, they're actually kind of going extinct in a way. There are way less DOs than there are MDs. The DO schools, there are way less DO schools than there are MD degree schools, and there are less DO or osteopathic hospitals than there are other hospitals. Okay, so it is kind of a dying breed. Only less than 6%, that's pretty low, actually. Less than 6% of physicians are osteopaths. Also, osteopath is another name for a DO. So if you see on a test that asks you something about which one is a physician, which one is not a physician, or something like that, remember, the osteopaths are definitely physicians, okay? Because those are the DOs. Please forgive my sloppy scribbles. All right, let's move on. Okay, so now let's look at primary care versus specialty care. So primary care. Primary care is the first point of contact in the healthcare delivery system, okay? And ideally, your primary care physician will serve as a gatekeeper. The gatekeeper makes sure that you don't move through the health system unless you have a referral. To see a specialist, okay? So they want to make sure that you actually need the specialty care that you're trying to go off and get. Okay, so that's kind of the whole point of the whole gatekeeping system, and that's what makes them the first point of contact into the healthcare delivery system. So really, essentially, like it starts, when something is wrong with you, it starts with your primary care physician. They will sort of evaluate you, they will figure out exactly what might be wrong with you, run some tests, and go, this is definitely a neurologist problem. We're gonna send you a referral to go see that neurologist over there. Okay, so generally that is, or ideally, that's how it works. Now, is that how it actually works in real life? No, not necessarily. It is pretty much how it works if you have certain, well, actually, in America, it depends on your healthcare plan. Okay. So, like, for instance, if you have an HMO plan, that would be a very strict version of a managed care organization type of a plan, okay? The HMOs are quite strict, and they definitely use the whole gatekeeping system, okay? Now, PPOs, they do not. They do not require you to go straight to your primary care provider in order to move straight through the system, nor do many of the other primary or private health insurance plans. Many of them do not require you to go straight to your primary care physician. So you're allowed to just skip that whole part and just jump straight onto specialty care, which may actually end up being way more expensive and also unnecessary. You might not even need that specialty care that you think you need, okay? So that's why it's super important in primary care for you to go straight to your primary care physician and for them to determine where you need to go next, okay? They would know better, all right? And that also saves money, which, prevents our healthcare expenditures from going through the roof, really. Okay, so primary care typically is longitudinal in that respect because you start here and then you just you work your way through. You start at the bottom and then you move up, okay, through the healthcare system. So basically, primary care, it's all taken care of by your generalists, okay? And most of the care that we do use in the United States is primary care. So it is necessary to have more generalists than specialists in that respect, okay? Primary care, they typically take care of the patient as a whole. This is, your primary care physician will typically know your health history. They know who you are, they know your family history, they know how things are going with you, and they're also there to follow up with you, check up on you, make sure you're going to where you need to go, and help you maintain your health. Typically, the primary care physician is the physician that will help you maintain your chronic disease if you have one. Okay, since chronic diseases are more, it's more of like a lifetime maintenance type of a thing, that's usually the job for the generalist or the primary care physician. All right, now let's look at specialty care. So, specialty care is episodic. It's not going to be an everyday thing. It's not something that you use for maintenance. It's episodic. It's when something is crazy, more complex, and needs more complex care. Then you go to your specialist, right? Usually, ideally, you would want a referral from a primary care physician. Okay, now let's move forward. In the United States, we have way too many specialists. Okay, remember in the previous lesson, we learned that during the post-industrial era, we started to develop this like mindset of, or physicians started to develop this mindset of like, hey, I can make more money, I can, develop more technology, I can contribute more to medicine, I can do so much more with this whole career if I specialize. Okay, well, that is true. However, we don't need so many. That gets very expensive, it's wasteful, it's unnecessary. We don't have a need for it because most of our illnesses that we have in America are chronic. Okay, or diseases, I'm sorry. Most of the diseases we have in the United States are chronic. Generalists take care of our chronic illnesses for the most part, unless our chronic illnesses can reach a level where we may have an episodic type of a health event stemming from our chronic diseases. Yes, sometimes that happens, and in that case, we do need specialty care. But for the most part, in order to maintain our chronic diseases, we need generalists, okay? And that's mostly what we have in this country are chronic diseases. So we do need more generalists, not necessarily specialists. So that is the term that describes this whole maldistribution between specialists and generalists would be called specialty maldistribution. Okay. Another way that we have another imbalance of physicians in this country is that of geographic maldistribution. Let me put that here. Geographic maldistribution. Maldistribution, okay? So what this is what it says. Most of the physicians that we have prefer to work in urban areas as opposed to rural areas. Okay, so we have a greater physician population working in the high metropolitan, higher populated areas, and way less working in the rural areas. And this does present a problem because the people in the rural areas do not have proper access to care. Okay. So why is there an aggregate oversupply of physicians? Well, remember back when in the post-industrial period when we started to see more physicians wanting to specialize? Well, we had a major increase in specialty physicians from 1950 to 1990. It increased by 173%, which is insane. That's an insane amount of specialist physicians compared to generalist physicians, okay? And the government doesn't necessarily mandate how these physicians are going to be trained. It doesn't regulate exactly. There is no regulation. Remember, we said that there is no government regulation in how we do healthcare. So really, there's nothing out there going, we need more generalists. We're going to only allow certain, some people to move on to become specialists, and everyone else all the other incoming new physicians are going to have to become generalists. We don't have anything like that. So there's nothing that really mandates how these physicians are trained. And the fact of the matter is that when you do want to become a specialist, of course, the teaching schools or teaching hospitals will make more money off of you when you do specialize. Okay, so there is more of an incentive for them to have more physicians specialize. So they do allow that to happen. So now we have a lot of specialists going into the primary care setting because we have so many specialists, right? Well, when that happens is specialty care is a lot more expensive or even primary care. It's going to be a lot more expensive coming from a specialist than it would coming from a generalist. Okay, and that is going to increase our healthcare expenditures, and that's actually quite wasteful. Okay. Also, I want to point out that a lot of the funding for medical schools and teaching hospitals is coming from Medicare. Okay, Medicare, that's the government's contribution to medical school. Okay, so through Medicare, a lot of it is funded through Medicare. That doesn't necessarily mean that the physicians are, like, their tuition is being paid for by Medicare. That's not what we mean. What I mean by that is Medicare is funding the research and development and like the resources for these teaching hospitals and whatnot, so that they can better train the newly coming specialists. Okay, so overall there is no standards. Yeah. So why do people choose to specialize? Well, first, you get to use all the best, coolest technology out there. You get to, you have better access to medical education and whatnot. You get to grow your knowledge in your craft, basically, because you're out there, you're working amongst many colleagues. You get to work with the highest levels of technology. You're usually working in a more advanced setting, more advanced hospital setting, and of course there's more prestige. You're going to make more money. Usually specialists are able to have much better work hours as well. Okay, many specialists actually work way less per week compared to generalists. Generalists can actually work like all day and all week and still make nowhere near the amount that a specialist might make. Okay, it's given where exactly the generalist is working, and of course also if they take Medicare, Medicaid, or anything like that, like depending on like also what type of insurance and the type of patients that they are taking care of in their area. Okay, but that will sort of determine like how busy they are. But especially as far as the specialist is concerned, they can regulate their hours a lot better, and they can work less hours, of course, and make so much more money. Of course, there's a lot more prestige. I mean, it's like telling someone you're a cardiologist. In our culture, it's more impressive than telling them you work in internal medicine, right? Yeah. Okay. So anyway, let's move on. Okay, so why is there a geographic maldistribution? Why are physicians choosing not to work in the rural areas? Okay, so some of those reasons are because less income. I mean, let's face it, you spend so many years in medical school and you have this like dream or vision of what your life is supposed to be like when you finish and when you get out there and you get to practice medicine. You expect more. Okay, and working in a rural area is not going to provide you with that. Okay, so physicians would rather not work there. Also, there's a lot less professional interaction. Well, duh, because there are less people that want to move to a rural area. Okay, then there's less access to, more advanced technology and to larger facilities, or facilities at all for that matter. I mean, typically in a rural area, you might have to drive 30, 40 miles to get to the nearest hospital. Okay, so, or nearest any kind of health facility. So they're not easily accessible either. Okay, of course there would be a reduction of the continuing education and professional growth because you're sort of isolated. Okay, and then lower standards of living, of course, because you have less income. So why is the physician maldistribution a problem? Okay, in terms of specialty maldistribution, first of all, when we have so many specialists, okay, way less generalists, now we have a high volume of intensive, expensive, and invasive procedures. Okay, we have more physicians trying to get more patients to, take on, to, agree to having their expensive, invasive procedures done on them. Many times, this isn't really what's necessary, but they sort of make you believe it is, right? Because they definitely want to get paid, and those are very expensive procedures as well. And given the fact that they're invasive, there's always risks. So it's not necessarily a great idea. Sometimes medical error can occur, and it could have been prevented, and it didn't even have to happen at all because that procedure was completely unnecessary. Okay. Of course, there's a rising in healthcare costs. Any kind of specialty care, even if you're doing, even at the primary care level, if you compare primary care given by specialists compared to a generalist, the generalist is going to charge way less money than the specialist. Okay, so using the same procedures even from a specialist is going to drive up our healthcare costs. Okay, and that's a huge problem that actually happens quite a bit in this country. Okay, now moving forward with geographic maldistribution, why is that a problem? Well, think of all the people in this country. 20% of all the people in this country live in a rural area. So you would think if we want to kind of keep the ratios even, maybe about 20% of our healthcare professionals, especially our physicians, should also work in these rural areas to better serve, the people there, right? So that everyone can have equitable access to healthcare. That's not what's happening. Only 9% of the physicians in the United States are actually practicing in these areas. Okay, so that's making it really difficult for a lot of patients, a lot of people in these areas to have access to healthcare. Okay. So there's a decreased access to preventative, primary, and specialty care in rural areas. Okay, so now I just wanted you to kind of look at other types of healthcare personnel, other health services professionals. So we have dentists, there are dental hygienists, pharmacists, other doctoral level health professionals like optometrists, psychologists, podiatrists, chiropractors, and we have different levels of nurses. Okay, we got your registered nurses, your licensed practical nurses, and your advanced practice nurses or your nurse practitioners. So typically our RNs have that next to their name, right? And then our LVNs or LPNs will have this. or LVN. Just to let you know, this will have a completely different degree, licensure, exam, different requirements to practice than this, okay? And same thing with our advanced practice nurses, but that's like a whole different level of nursing, okay? So let's move forward. Now we're gonna look at non-physician practitioners, okay? So what a non-physician practitioner is, basically, this is a health professional that can kind of do pretty much what a physician does, okay? Or at least a generalist physician, okay? So they pretty much do generalist physician work. The only difference is they don't have a physician degree, they don't have a doctoral degree, and for that reason, they can get paid a lot less. And we're gonna see that these are what we're going to be using for the rural areas to so that they can have better access to healthcare. Okay. Now we have dental care providers. So we got the dentist, these are the doctors of our mouth, okay, teeth, gums, and mouth. Then we have dental hygienists and dental assistants. Okay, so of course the physicians will definitely need licensures. The dental hygienists will also need licensures. They usually have a bachelor's degree as well, okay? But the dental assistants do not need a licensure, okay? Now let's look at the pharmacists. PharmD degree is typically the most popular degree right now. That's being said, you can also get an RPH degree. Okay, so the PharmD degree is like the doctoral level degree of the pharmacists. The RPH degree, and that can be more of a bachelor's degree or a graduate level degree. It's not going to be a doctoral level degree. Okay, so typically your RPH degree pharmacists will probably work in retail pharmacies and settings like that. And then we're going to have our PharmD degrees are going to be responsible for even more things. They're usually part of like a full healthcare team, okay, working with physicians and other nurses and other parts of the team, usually at hospitals, and they do a little bit more than just retail pharmacy stuff, okay? While you can get, this is cool to have because physicians or pharmacies would be more willing to hire you, especially if it's just a retail pharmacy, because they don't necessarily have to pay you as much. That being said, this has a lot more going on. So in addition to being part of that, that integral part of like a healthcare team, and working with other providers and at hospitals and doing a lot more things, they can also work in academia. Okay, and of course all pharmacists definitely need a license to practice. So next, actually you can go ahead, and I want to invite you just to kind of scroll through all the different other types of health professionals. This can kind of get kind of mundane, so I don't necessarily want to go through them. It's very, I'm pretty sure we're all familiar with these different types of health professionals, and what I just want you to pay attention to is just kind of go through and look at what each different type of professional basically does, and then just figure out or keep in mind who needs a license. And spoiler alert, most of them need a license, okay, unless you're a tech or it's like a vocational type of a occupation. You're going to need a license in healthcare. Okay, So same thing with your chiropractors. Go ahead and look at that. Nurses. The nursing profession developed like as an actual profession with nursing school and degrees and whatnot after World War I. Okay, so before that, it really wasn't like an official career, like official healthcare professional, right? So you definitely need to be licensed to practice if you're going to be a nurse. And remember, I told you about the two different licensures that basically bedside nurses can have. So you can have the RN degree, and then you can have the LPN degree, or LVN is another one that you can get. Now, registered nurses usually have either a bachelor's degree or they have an associate's degree. Okay. LVNs or LPNs usually go to like a vocational program. Okay. In California, usually the vocational program will have to be a vocational school, like a separate location. However, in many states, actually, a lot of hospitals will have like a vocational program built into their hospital. So they'll train people who want to become nurses. They'll actually host classes and get you through their program and help you get licensed. So that's pretty cool. So in these next coming years, we are going to experience a major shortfall of nurses. We are currently in the year 2020 right now, and it's said that we are definitely going to have a shortfall of 340,000 RNs. That's quite a bit of nurses that we are going to be missing in healthcare. Okay, and I think we are actually experiencing that a lot right now, especially times like these when you have pandemics going around, and we really need more healthcare, and we're finding that we kind of weren't necessarily ready. We don't have the supplies, nor do we have the healthcare workers that are ready to take all of this on. But the trend right now is we do have a major shortfall of nurses. Okay, we have many nurses who are trained, but they're not necessarily working. And the reason why they are not necessarily working is because many nurses experience high levels of job dissatisfaction, burnout, and they just kind of quit. Also, well, let's move forward. I think I have something else going on this other slide. So why is there a shortfall of nurses? Sluggish wages. Typically, yes, nurses do make decently good money, really depending on where you're working and the job title and whatnot. But given the workload, if you compare the workload to the wages, it doesn't really match. Okay, nurses do too much and receive too little. Okay, so they experience high, low job dissatisfaction. Okay, and there's typically terrible career mobility within the nursing profession. Most people stay stagnant, like they're just stay in one place, and you see this a lot, especially with the previous generations, where once you become a nurse, it's like you just work at one hospital pretty much for the rest of your life, and you don't necessarily move on, because there isn't the best career mobility within this profession. Also, we have less and less people trying to go to school to become nurses. Okay, and it's due to this stigma now that's going around. Is like nurses, as a profession, you're gonna experience burnout. It's gonna be really difficult, and the money is not worth it. Okay. All right, let's move on. So, what is being done to kind of solve this nursing problem? In 2002, the federal government enacted the Nurse Reinvestment Act. Okay, so what this did was several things. First of all, it gave grants and scholarships to try to help, attract new people to want to go to nursing school and become nurses. Then it also they put out programs that help encourage nurses to go get more degrees, to go get your master's or whatever, so that you can, move up. Okay, and they also offered many retention programs. Okay, a lot of these programs, especially with magnet hospitals, these magnet hospitals have built-in practices that help make nurses feel at ease, feel supported, and not necessarily want to leave the hospital or leave the profession altogether. So in a lot of these magnet hospitals, the nurses do experience a little bit more job satisfaction. Okay, so and less burnout, which, surprise, surprise, when nurses are less burnt out, we have less medical error, and that increases patient safety. Okay, so we have 4 different types of specialization for those advanced practice nurses. So these are the nurses who went on to go and get their master's degree. Okay, so you have clinical nurse specialists, certified registered nurse anesthesiasts, we have nurse practitioners, and certified nurse midwives. Okay. Typically, the CNSs will stay and work in hospitals. Same thing with the anesthesiasts. Well, yeah, same thing with the anesthesiasts. They usually work in hospitals or at least surgery centers and whatnot. Nurse practitioners will usually work in primary care. What we may see happen in a lot of cases, are that nurse practitioners, they will take up jobs in primary care and they'll pretty much treat patients as if they were generalists, okay, general physicians. And that is actually helping this whole shortfall of not having enough generalists in this country, okay, and not having enough generalists to take care of our primary care needs. Okay, then we have other non-physician practitioners. Well, basically a non-physician practitioner, like I said before, is similar to a physician. Okay, they just don't have a physician degree. However, they can do pretty much everything that a generalist can do. Okay, the same thing with physician assistants. These are non-physician practitioners. Okay, they do pretty much the same thing as a physician or a generalist physician. However, they do not have a physician degree. These practitioners also, they're not technically supposed to practice unless they do have a licensed physician supervising. Okay. Let's move forward. So, nurse practitioners are also another type of non-physician practitioners. Just in case you didn't figure it out already, they can do the same thing as a general physician. All right, and then we have a global workforce challenge that I want to go through. Okay, just to let you guys all know, we are experiencing some severe workforce challenges in developed or developing nations compared to the developed nations, especially in sub-Saharan Africa. 57 countries are actually going through a workforce crisis, a health workforce crisis. There are 23 healthcare workers per 10,000 people. That number is insane. Okay, they are in severe need of more healthcare professionals over there. Also, so one major thing that I want to point out here is we're experiencing, or what we experience usually, is a brain gain And in many of these developing countries, you usually experience a brain drain. So what that is when migration happens, usually what happens is those health professionals living in other developing nations, they tend to move over to developed countries so that they can have a better life, have higher wages and whatnot. When that happens, we benefit, those of us in a developed nation, we benefit from that because now we're gaining more intelligent health professionals here. But those developing nations that they came from, they're losing a health professional. Okay, and in many cases, that was a much needed health professional for that community, and now they're gone. And the sad part is that country invested in that individual. Okay, I'm sure they had a lot of promise. They felt like that individual was definitely going to, help the community and whatnot. So that country has invested in that individual, and that individual took his knowledge or her knowledge and of health, and they moved to and brought it to a whole new country. So they experienced a brain drain. They lost knowledge. They lost a health professional, and we gained one. So they are experiencing the shortfall. We are not. Well, in that sense, they're having a harder time, and we're not suffering as much. This is a list of different health service administrator degrees that you can get if you are going to move forward in your health administrative career. Okay, usually what I want to say is that if you're planning on only receiving your master's or your bachelor's degree in health administration or health services administration, you will more than likely work as sort of like a line manager level within healthcare, or you might be like an administrative assistant in maybe an office manager, something like that. Okay, and you can probably work your way through the system, but at a certain point you won't necessarily move too much higher. And the reason for that is usually these organizations, especially in healthcare, they definitely want higher degrees in those higher level positions. So if you are looking to advance in a career where you may be an executive or like a higher level supervisor or just some really high level leadership position within health services administration, you should really seriously think about getting a master's degree after your bachelor's. Okay. This is a list of many challenges that health service administrators may face working in healthcare. And here are some videos that I recommend you try. I don't think that you can necessarily get the links here, but on the actual, the original PowerPoint, which is posted on the website, you should be able to access that, and that way you can copy and paste, or maybe you can actually click on the link itself and it'll take you to the video if you're interested. Okay, and that is the end of lesson 4 of the Medical Care Organizations course. If you have any questions or comments, please leave them down below or on the website, or you can always shoot me an email and let me know.